You see, as a county, we resolved on we can't punish our people because of the teething problem. So everybody comes to the hospital, is treated, registered, and if they are not registered or they have a problem, because some of them, if you don't have ID card, you cannot be registered, but they still get treated. Those who have ID card, we know we'll claim later. But in the short term, we are suffering because if you don't get the returns. But I'm also glad to report that Kilifi had just received last week, I think, 29 million. Between NHIF and SHA, we are owed about 210 million. So slowly we are claiming. We hope what the new minister promised of 14 days, it will work, because that means then it reduces a lot of burden. Yes, we have challenges. We have drugs, maybe some are missing, but we are trying our best. You know, we are buying all these things and we don't receive a shilling. The last months, basically, since SHA has started, we are treating patients, whether they have a SHA registered or not, we deliver services to them. So it's an issue which, as the chair have said, they are following up. But while they are following up, I want to assure the Kilifi residents that nobody will be turned away because they are not registered or they have forgotten the ID card, because we register them on the spot now. And the CHPs are doing that program for us now, machinani. But even if you are not registered and you appear at the hospital, you'll be treated. I'm glad we have only one case. There are counties where money was deducted, including Kilifi with the defunct municipalities. When I took over this county, we owe a lap fund, almost 400 million. We owe, lap fund is the biggest. We owe Lengo Sacco, 50 million. I've just ordered them to be paid 25 million just the other day. So that we cannot deduct funds, then people retire. Some of them die, having worked so hard for many years, and their families cannot access 1 shilling after they die. So we said that one we must pay. If it takes us time to pay it gradually.
We have visited some hospitals in Malindi, and here we'll also visit them just to find out whether SHA is working, and where it is not working, we'll also make the recommendation. So we are combining that with our visits, and we'll be able to, when we go back to Nairobi, after visiting the 20 counties, we'll be able to advise the Ministry of Health on the challenges that the wananchi are facing in various counties with regard to the implementation of SHA. To a large extent, SHA is working, but there are certain teething problems that need to be addressed, and those ones are the ones that we are going to address to improve it and to be able to make sure that the Kenyan citizens get the health care, and especially primary health care that it deserves. Kuna shida, kuna tatizo la kufanya kuweka hiyo mpango, because it's a new program, but the good thing is that they are being resolved. So in all the countries that we have gone, where there have been complaints, they are resolving them, and that is why we are here. The citizens of Kilifi County have a mechanism of reporting any complaint that they have in terms of public service delivery failure, and they're able to redress it. The governor has just talked about performance contracting, and we have agreed that we will be monitoring their service charter, because these are part of the efforts that are aimed at ensuring that if the governor and his team has promised that they are going to deliver X, Y, Z service to the members of the public, then we hold them to account, because we'll do spot checks and see is this happening the way it is, and that is what we want to achieve. So there's no gap at the moment, but we are working with them to develop the grievance redress mechanism as well as access to information.